Welcome to this explainer, where we're unpacking a genuinely exciting advancement in the world of cosmetic dermatology. You know, if you've ever felt stuck between a rock and a hard place with anti-aging treatments, like you either have to settle for topical serums that don't do quite enough, or risk that completely frozen, expressionless look from injectables, well, you're definitely going to want to pay close attention today. We've got some fascinating science to break down.
So let's just dive right into the ultimate question on every skincare-savvy patient's mind. Do we really have to sacrifice our natural facial expressions just to soften those dynamic early aging lines? For years, that's just been the accepted trade-off, right? But the source material we're looking at today suggests a massive paradigm shift is happening right now in aesthetic medicine.
Here's our roadmap for how we're going to cover this. We'll start by looking at the aesthetic gap, then we'll introduce MesoGel BTX, break down its active formulation and treatment areas, dive into a quick competitive analysis, and finally, look at how it preserves facial expression. Let's get to it.
Starting off with Section 1, the aesthetic gap and the dilemma of modern anti-aging. We really need to look at the current landscape where patients face a very specific and, honestly, frustrating dilemma. Until now, you basically had to choose between the lack of true structural efficacy in your daily topical serums or the heavy, sometimes frozen look of traditional deep muscle injectables.
The source catalog actually establishes a brand new baseline for what an injectable dermal device should achieve. It shouldn't just paralyze a muscle, and it shouldn't just sit on the epidermis doing nothing. It needs to actively restore fluid balance and elasticity across the upper dermis, setting what they call a true hydration and plumping standard.
Moving to Section 2, introducing MesoGel BTX, the 2-in-1 hybrid dermal gel. Let's actually look at the specific solution developed to fill this exact gap in the market. Meet MesoGel BTX from the Dermatological Choice MesoGel Collection. This is an injectable dermal device engineered specifically as a 2-in-1 hybrid gel. Basically, what that means is it's designed to deliver deep bio-revitalisation while simultaneously smoothing out the appearance of fine wrinkles, all from a single syringe. It targets those early signs of aging beautifully, without adding any of that excess, unnatural volume to the face.
The magic really starts with its foundation. A 2% or 20 milligrams per milliliter high-purity, non-cross-linked hyaluronic acid matrix. Now, because it's non-cross-linked, it acts as a fluid structure, spreading incredibly smoothly under the skin, almost like water, rather than sitting there like a hard lump of filler. This ensures a seamless integration during microinjections, which gives the skin instant radiance, deep moisture, and a completely biocompatible profile.
Into Section 3 now, the active formulation, HA plus peptides. Because having a fantastic hyaluronic acid matrix is really just half the story here. Let's break down this second, highly innovative pillar of this formulation, the triple neuro-peptide complex. This whole formulation relies on a multi-pathway blend of 3 active neuromodulators that just work brilliantly together. First up is Acetyl Hexapeptide-8, better known as Argireline, which works at the presynaptic junction to reduce acetylcholine release. Then we have pentapeptide-18, or Leuphasyl, working in synergy to lower neuronal excitability. And finally, aminobutyric acid, GABA, steps in to provide a really fast-acting relaxation of surface microcontractions. It's a precise 3-pronged approach to softening expression lines.
The source material actually names this complex the neuromodulating catalyst. And it's a perfect name, really. Why? Because it actively relaxes expression microtension without freezing the muscle movement beneath it. It simply dampens the signal transmission at the neuromuscular junction, essentially smoothing the canvas of your skin while leaving the mechanics of your smile and your frown completely intact.
Which brings us to Section 4, treatment areas beyond the face. Now that we understand the biology and the formulation, let's explore exactly where this intradermal microdroplet injection is applied to effectively address early aging.
The versatile application covers 3 key geographies, which is fantastic for comprehensive rejuvenation. First, you have the face, where it softens dynamic superficial lines like forehead creases, crow's feet, and those perioral wrinkles around the mouth. Second, the neck, restoring vital hydration and targeting surface crepiness. And third, the décolleté, where it refines texture and reduces fine lines heavily associated with sun exposure. Because, as we all know, skincare absolutely shouldn't stop at the jawline.
Okay, Section 5, competitive analysis, MesoGel BTX versus the market. Let's dive in and see exactly how this stacks up against the standard treatments you might already be pretty familiar with.
If you look at a direct clinical comparison, notice the onset column here. MesoGel BTX offers the immediate glow of HA combined with progressive relaxation, whereas traditional botulinum toxin type A has a delayed onset, usually 3 to 14 days. Plus, MesoGel BTX relies on an intradermal microdroplet injection technique, which is way less invasive than deep intramuscular injections. You're getting an injectable result, but completely sidestepping the risks of localized paralysis, facial asymmetry, or ptosis, which is just the medical term for that unintended eyelid drooping nobody wants.
The true differentiator, though, is the core mechanism of action. Traditional botulinum toxins cause irreversible SNAP25 cleavage. Literally, they permanently cut the communication wire until the body heals, physically stopping the muscle from contracting entirely. MesoGel BTX, however, acts as a non-paralyzing bioactive gel. It uses multi-target signal modulation. Think of it like turning down the volume on the nerve signals causing surface tension rather than unplugging the speaker entirely.
Section 6. Preserving expression, the ultimate goal. This leads us perfectly into our final section, which highlights what is arguably the most important patient outcome of this entire explainer.
And here is the absolute ultimate advantage, the preservation of 100% natural facial expression. You maintain full facial mobility. By keeping the treatment localized to the dermal layers and relying on peptide signal modulation instead of deep muscle paralysis, patients can visibly soften those dynamic lines without ever losing the essence of how they communicate emotion.
By combining 20 milligrams per milliliter of high-purity, non-cross-linked hyaluronic acid with 3 active neuromodulators, GABA, Argireline, and Leuphasyl, MesoGel BTX genuinely represents a new, highly safe, and fully biocompatible standard for dermal revitalization. It's just an elegant solution that addresses the hydration and plumping needs of the skin, while gently coaxing tension out of the surface.
As we wrap up this explainer, I want to leave you with this provocative thought. If we can now effectively modulate nerve signals to erase wrinkles and completely revitalize the skin across our face, neck, and chest, without ever freezing a single muscle, how is this 2-in-1 hybrid technology going to redefine the entire future of aesthetic medicine? Thanks so much for learning with me today, and I highly recommend diving deeper into the science of biocompatible peptides if this sparked your curiosity.